break this. She's doing MP flexion. Yeah, I'm gonna. It's a little bit. It's a little bit, subjective. I'll try to break it. Okay. Usually these two fingers are strong. I'm not gonna do this finger. I'll do this. Okay. So that way you know which finger. These pinkies, even though you have pinky extra muscles, I think that's why you have an extra muscle, even though it's too weak. Okay. So that's how you do MP flexion. Can you read the next one? MP extension. Okay, like this. Okay, and then I'm going to press it. She's extending like this. I'm going to press it. Okay, see, hyperextended. Technically hyperextended. I'm pressing it. Okay.
She's trying to push the resist against you.
Yeah. So see, like she's extended. I'm just. Okay. So what else do you have? PIP flexion, simple. This is the PIP, right? So I'm going to. Sorry, PIP. PIP is here. MP is here. PIP is here. So I'm going to ask it to bend. That's it. Okay. So I'm just going to prevent it from bending. Same way, prevent it from bending, DIP. Okay. Or you can ask the patient to bend it and then you can try to extend it. Okay. You can bend it and extend it. Either way. You can do a lot of break tests. Just be aware how strong the patient is, and in old patients with arthritis and all these things, don't do break test. Just gently let them do it, or you can kind of hold it and gently ask them to do it. Okay. So DIP flexion the same way. DIP flexion is also the same. Okay. So in these things, you're basically trying to see if you're stabilizing it, holding it properly. That's all we're basically looking at, since you don't do it that often. The range of motion, you're looking at where you're placing your goniometer. You're placing your goniometer properly. Okay. Abduction. Okay. So when you do, this is palmar abduction, radial abduction, right? So radial abduction, ask her to do it like that and then resist here. That's all. Make sense? Palmar abduction. So if she's coming this way, can you go like that? Resist here. That's all. Just hold it and resist it. Make sense? Okay. They may not ask you exactly where you put resistance. When I'm holding like this, I'm preventing her from coming like that, and I'm preventing her from coming like this. Okay, can you come up? Yeah, that's it. It's pretty simple. And thumb MCP extension. So this is the thumb MCP extension. So I'm just going to prevent it from extending. Same like this one, your thumb does extension here. So I'm preventing it from extension. So extension, IP extension. Can you go? Extend your thumb in this finger. Yeah, that's it. So ask the patient to come like that, or you can hold it. You can. I usually hold the finger like this and ask her to go up, and I can resist it. So can you come up? This is pretty flexible too. Did you sublux?
What?
Did you sublux?
I don't know. I'm double jointed though.
Oh. It's like she does sublux and puts it back. Okay. And what else? Thumb extension, and MCP flexion. Yeah, MCP flexion. So this is the flexion of MCP. Again, hold it. Ask it. See, can you do like this? That's it. So I'm asking the patient, can you do like this? So in the thumb, in the hand and all, you have a long range, right? So can you do like that? You can show. In the thumb, in the hand, just show them. Can you do like this? Can you do like that? Can you do like that? Can you do it like this? Can you do like this? Show them and then resist it. Okay. If you have somebody else, some other examiners, make sure that they're watching you. Okay. Just do it in front of their eyes so they know that what you're doing. Thumb IP flexion. Palmar abduction. Okay, palmar abduction, again, I showed you guys. Palmar abduction is like this. So the action takes place here. Okay, So your resistance, this is what you're resisting. Technically, you can resist wherever you want, but make sure you're testing this muscles. So I'm just going to give a resistance. Can you come up like that? Okay, that's it. And then IP flexion. So thumb IP flexion. Can you bend? Don't let me push it out. That's it. Okay, I'm just going to, or I'm going to give resistance and ask her to press it along two ways. Resistance throughout the arc or break test. Choose, right? Resistance throughout the arc or break test. So either way, just make sure that you give the patient enough information as to what you're doing. Can you bend your finger? Okay, good. It's pretty strong, right? So thumb radial thumb adduction. Okay. Radial abduction is this. We did it. Radial abduction. Radial abduction. Outside. Come outside. Radial abduction. Okay. Palmar abduction. Adduction is like. Can you hold this? Don't let me push. Okay. Adduction. Adduction. It's like holding a key. We don't necessarily do a little bit. So, okay. Thumb adduction. So technically speaking, you can also do adduction of the fingers too. Same like that. It's pretty strong. Okay? So that's basically all you do. Or you can you do like this? And then you can separate it. Try to separate it. Okay? Same way, can you hold it like that and try to separate it. Okay? So, and did it come okay? Thank you.